Hi, my name is Sheri Paulsen, and I'm going to be presenting my final project for the WGU Master of Nursing and Leadership. My project was titled Postpartum Mood Disorders, a Protocol for Standardized Screening. So a little background on postpartum mood disorders. It is one of the most common medical complications of pregnancy. It affects 7 out of 10 women. Maternal suicide also exceeds both maternal hemorrhage and hypertensive disorders as a cause of maternal mortality. Early symptoms can be detected with systematic screening processes. ACOG and AWAN both support screening with a validated screening tool at least once during pregnancy. For the problem statement, in the Family Birth Center unit of the hospital in which this project took place, no nursing protocol or policy guiding nursing actions surrounding postpartum mood disorder screening was present. A lack of a protocol resulted in an unstandard practice for postpartum mood disorder screening, and lack of standardized practice resulted in missed screens, missed follow-up opportunities, and missed education for patients. For a problem background, screening was initiated in 2018 with minimal education guidance for nursing. No nurse-driven protocol was in place at any time during this initiation. No clear process was in place for administrating the screening, patient education, or a follow-up plan for concerning scores. Patients were also screened using the Edinburgh Postnatal Depression Scale. This screening tool is not used in any other area within the organization, and providers and nurses are unfamiliar with this screening tool and the screening results of the tool. So the practice change, quality improvement, and innovation that was proposed was to create and propose a nursing protocol for postpartum mood disorder screening for the Family Birth Center nursing staff. This was to create a standardized practice for postpartum mood disorder screening, to eliminate confusion for nursing staff surrounding postpartum mood disorder screening, to decrease missed screens and improve patient education and follow-up care. In turn, this would also improve patient outcomes through improved screening practices to consistently identify patients at risk for postpartum mood disorders. So the rationale for the project. This was identified as an immediate need by nursing leadership in the Family Birth Center to improve the standardization of care, the effectiveness of the practice, and to improve patient outcomes related to postpartum mood disorders. ACOG, AWAN, and the U.S. Preventative Services Task Force all have identified screening for postpartum mood disorders as a high priority. Due to limitations for time requirements, the implementation of the proposed protocol was outside of the scope of this project. That is due to the fact that this hospital is part of a larger organization and enterprise that requires standardization of practices. So any protocol changes, proposals would need to go through several enterprise-wide committees. That was outside of the time frame scope for this project. So the review of the literature identified several things pertinent to this project. The first was a common theme of recommendation for universal screening for postpartum mood disorders. Universal screening programs were found to be both feasible and improve detection and treatment of postpartum mood disorders. In the literature review, it was found that universal screening was recommended to be done at least once during the perinatal screening period with a validated screening tool. Literature review also found that nurses and perinatal patients both support postpartum mood disorder screening. During the literature review, no specific time frame or screening tool specifically recommended was found. There was no one specific time or tool that was recommended through any of the literature for this. However, it was found that screening within 96 hours of delivery is predictive of later postpartum mood disorder screening scores. This is important to this project as we were looking to screen within that 96-hour time. Also pertaining to this project, the Edinburgh Postnatal Depression Scale and the Patient Health Questionnaire 9 can be used with equal confidence. And this was important to this project as the PHQ-9 screening tool is the one that is used in all other areas of the organization and enterprise for general depression screening. So it is a much more familiar tool for providers and nursing staff and patients. So the recommended change based on the literature review was to create a nursing protocol for postpartum mood disorders for use in the Family Birth Center unit to meet evidence-based best practice guidelines. These guidelines would include universally screening all women after birth, screening the patients within the first 96 hours of delivery, and utilizing the PHQ-9 screening tool. For implementation, the first steps in my project was to meet with the nursing manager of the Family Birth Center unit to discuss unit needs, to choose the project, and define the scope of the project. I then met with the nursing administrator acting as my preceptor to approve the project and the scope of the project. I then began to review the current process for postpartum mood disorder screening and education. This review took place with the nurse manager and the Family Birth Center Unit Council, which is their shared governance, made up of highly respected and skilled staff nurses within the unit. And then during that time, I also conducted the literature review. Next steps in the implementation was to create that nursing protocol, utilizing evidence-based best practice guidelines found in that literature review. This protocol was then presented to the Family Birth Center Unit Council. Again, that is made up of the highly respected and skilled members of staff nurses on the Family Birth Center unit. I also, after meeting with the unit council, requested but was denied the opportunity to present the created protocol to the medical and social work teams that work in the Family Birth Center unit. Final steps in the project. So based on the Family Birth Center Unit Council feedback, they requested no revision or additions to the created protocol, so none were made. This protocol was then presented to the Family Birth Center nurse manager for her approval. She did agree to now take this protocol on to greater enterprise-wide committees for approval. So changes to my original implementation plan. The biggest one, and the one that had the most impact, was that the created protocol could not be presented to the medical and social work teams. This took out two of my stakeholders that I had planned on getting feedback and hopefully buy-in from these teams, as it would affect them with the follow-up care that would be needed after getting the scores. Unfortunately, this could not be done. Another change that was made to the original implementation plan was that no changes were made to the protocol after presenting it to the unit council, as they did not see any revisions that they wanted made to this protocol. Another change that was made was that the review of the current processes and the literature review happened concurrently instead of the literature review happening prior to the current process review, and that was to help guide some of the literature review to address barriers and challenges and questions that were in place already with the Family Birth Center and the staff nurses on the unit. So barriers to the project. The main barrier was that inability to include the medical and social work teams for feedback on the created protocol. Now this was due to current regulations that are in place to protect provider time. Because this was a student project that has not been vetted through any nursing committees or approved by anything, and is not going to be implemented at this time, it was deemed that it could not be brought to the medical and social work team. So this barrier could not be overcome for this project. Weather also prevented a rather significant barrier at the end of the project. Living where we do, there was several severe winter storms that came through our area, which delayed meetings that I had with the nurse manager to propose the protocol due to hospital needs at that time. These meetings were just rescheduled until we could have them at a time without some severe weather, so that barrier was overcome. Transprofessional relationships. For this project, there were several stakeholders and people that were assisted me during this project. The nurse administrator was the first one. She was my preceptor who approved the project and the scope of the project. The nurse manager was a critical relationship for me. She assisted with finding and identifying the project, approving the scope and the project itself. She assisted with identifying current processes and could speak through some of how the project or how the current processes were put in place and what kind of education and rollout was done during 2018 with that. She was also the recipient of the final proposal of the protocol. The Family Birth Center Unit Council were critical in assisting with identifying current processes and barriers and concerns with postpartum mood disorder screening. They also reviewed the created protocol for needed revisions. I needed this team to be on board and behind this project for bringing it forward. If they did not give their support, then this probably would not have gone very far with the nurse manager as well. The nursing education specialist was important for helping me to identify available education material for patients regarding postpartum mood disorders, as none were really in place on the unit at the beginning of this project. So Capstone successes, the number one success for me is the increased awareness of the importance of postpartum mood disorder screening, not just by the nurse manager who received the final proposal of the project, but the Family Birth Center Unit Council members, being as their staff members on the floor, and we are already screening patients just without a clear protocol. Their buy-in and understanding of the awareness of the importance of this screening and why we need to do what we need to do can really drive change before the protocol would even be implemented. There's things that we can do right now to improve our screening practices. So that to me was the biggest win. Increased awareness of the best practice recommendations is also another big success of this project. Before this project was done, the nurse manager was working to implement the enterprise standards of screening patients based on a criteria instead of universally screening. So that is one that she is no longer working to put in place. She is looking now to bring it to the enterprise to change their practice as well to universally screen women based on best practice guidelines. Protocol, like I have stated, the nurse manager is now working to bring this to the enterprise practice committees for change across the enterprise, not just in the Family Birth Center. So impact on future projects. Thorough literature review was the strongest driving factor of all of the support for this project. All of the recommendations made were based on evidence-based research. It could address all of the concerns and questions that the Family Birth Center Unit Council had, that the nurse manager had. The strong evidence base then improved acceptance and support of the protocol because of that literature review. The scope of the project was also a important part of something that I would bring forward to future projects, is to make sure your scope is reasonable, something that you can achieve. The reasonable scope ensures adequate time to complete thorough review of current processes and literature. Thorough review does help ensure adequate support for the project. Challenges of the capstone. The number one challenge for me was a lack of understanding of processes for involving the stakeholders. Being unable to involve the medical and social work teams due to lack of understanding of regulations for utilizing provider time took out two large stakeholder groups from my project. It did change how I had to look at the project. Personnel and project time was wasted attempting to involve these teams. If I had understood the regulations at the outset, I could have avoided that. So recommendation for future projects would be to explore any regulations or barriers for involving the stakeholders in the initial planning phase of the project. So evidence and current practice, again, the literature review was the main factor in persuading the stakeholders that change is needed. The stakeholders, because of that thorough literature review and the evidence that they could see clearly, they now feel strongly that change is needed across not just the Family Birth Center, but the larger enterprise practices based on that literature review. The recommendation also to change the screening tool is also now strongly supported by the stakeholders because of the information gathered in the literature review that both screening tools can be used with equal confidence. The literature review also gave reassurance to the Family Birth Center team, and they can bring that back to the staff nurses on the unit, that screening in that immediate postpartum period is beneficial to patients. That was a concern that they brought forward. So post-implementation, immediate support for this project for me would be continued support through sharing of the literature review and project materials to the nurse manager as she works to bring this forward to the larger enterprise committees. Post-implementation needs, if this protocol were to be adopted on the unit, would be the nurse manager would be responsible for coordinating implementation efforts. She would also be responsible for ongoing monitoring of the implementation of this protocol adoption through chart audits. The nurse educator would be responsible for educating nursing staff about the protocol and also for maintaining patient education materials and adequate patient education on the unit for postpartum mood disorders. The unit council members would be responsible really for helping to be those change agents on the unit, with their deeper understanding of postpartum mood disorders and what needs to happen with screening in order to improve quality outcomes for patients. They can really help drive this forward. So resources for post-implementation, personnel-wise, you would want the nursing education specialist, the nurse manager, and a staff member assigned to chart audits. For paper materials, you want to make sure that you have adequate patient education materials on the unit to hand out to patients at all times. And you'd also want to make sure that you have a way to hand out the screening tool to the patients. Online resources would include online learning resources for staff, such as web-in services and things like that. So this project really did integrate several of the MSN program outcomes, and the main two for me, the first one was to utilize applied research outcomes within the practice setting, navigating and integrating care services across healthcare systems. For me, again, the literature review really was the driving force behind this project. It changed what I was planning to put on the protocol. It created best practice guidelines. And then in the end, the protocol itself is hopefully going to drive not only change in the Family Birth Center, but across the healthcare system in the larger enterprise. The second one was designing innovative nursing practices to impact quality outcomes for individuals, populations, and systems congruent with ethical, professional, and legal standards. This project really hit a lot of that, innovative in creating that protocol, to impact the quality outcomes for patients and their families. This is meeting professional and legal standards and best practice guidelines through ACOG, A1, the U.S. Preventative Task Force. So all of the changes recommended were based on those things. As nurses, we tend to look at things as this is the way it's always been done. Let's not change what we know what we're doing. And as the master's prepared nurse, you really have to be ready to challenge that, to bring different ideas. Even if it's an enterprise-wide practice, doesn't mean that as a master's prepared nurse, you shouldn't be ready to challenge that if the evidence-based best practices are different than what is being done throughout the enterprise, which is what this project is doing. So that was a big part of this project, was trying to bring it forward, not just for the Family Birth Center, but across the enterprise in order to improve quality outcomes for patients and their families across the health system. I have also included my references here for your review, and I thank you for your time.